Hi Ingrid. We got a lot of questions from staff this month. The first one says, I have noticed that they're not doing automatic COVID screenings in the ER this season, even on patients that present with symptoms. Is that something that we should be doing?
That's such a good question. So when I went to go follow up on this, I actually discovered that we were having a little bit of change in our practice, whether it was somebody who was, screening in triage or screening in the patient ED room. And because you asked, we are now following up, and that's actually going to the system meeting on February 5th to make sure that we are appropriately screening. So this is a perfect example of why you guys need to ask these questions, because we didn't know that there was a change here and want to make sure that we're appropriately screening, and if we're not, that we make sure that we have the right reason why we are not. Because you're right, this is a very busy cold and flu season, and we should be appropriately keeping people safe.
Thank you. This next question we seem to get a lot, so if you'll just give us a quick reminder. Will St. Luke's East or BJC employees receive a cost of living increase like other major Kansas City health systems have provided to their employees recently?
Yeah, so compensation every single year does a market and a merit evaluation. So PMPs are going right now, they're due on the 31st, so hopefully you know what those scores are. If you qualify for that merit, then those will be adjusted. Usually we're in the March timeframe, but this year, because we're sort of integrating with BJC, theirs was a little bit later, ours was a little bit earlier, so we're going to have those be effective in May, and there will be a proration for that. So those will happen a little bit later than in typical years, and then every year with every job description we do an analysis of where the market is and what needs are appropriate. There's one bucket of dollar bills that we can use for those purposes, and we sort of look at who is the most behind and shore those up, and if you are part of the group that will be impacted, you'll be communicated to.
Thank you. A couple safety issues. Construction employees and their equipment are taking up a majority of the employee and patient allotted parking lots. Can we do anything about that?
Yeah, so this was a good one. I had to talk with my operations friends about this because parking is not my forte, but what I discovered is that they should be parking in the southeast temporary lot that is along Douglas and in the southwest corner at the back of the campus. And because you brought this up, we will be re-communicating this with McCarthy and making sure that they understand that. Now, if you're one of the folks coming in early and you see that folks are maybe in construction and not parking in the right place, feel free to escalate that to your leader so we can do some follow-up, because it is important and they should be parking where we've asked them to. So thank you.
Along with parking lots, what are they doing to address the lights in the North Medical Pavilion? Seems like we've called security, but they've been out for a few days. It's pretty dark over there in the mornings and evenings.
Yeah, so we've actively been addressing this now for a little while, and the facilities team actually brought in those temporary lights. And we put those in until we have a long-term solution. So the fix was a little bit delayed because we need to get the lines underground, and those big snow piles are getting in the way. So we have a plan to get those all underground, and in the meantime, when we're able to actually do that permanent fix, we'll keep having those temporary lights there. If you feel like something is not lit properly, if you feel like there's something needed, let us know. And as always, your security team is here to help support you. And if you need an escort back and forth to your car, that's completely appropriate as well.
Thank you. All right, the last question for today. We heard that there is a change with how we are handling supplies, and it seems like a lot's being thrown away from inpatient rooms. What are we doing to address this?
Yeah, so this is a good question. So about a year ago, we started looking at the way that we are stocking and restocking inpatient drawers, particularly in the MSI areas, but really all areas. And we set a particular par level for each of the items that we identified as needing in those drawers. And the reason why I originally looked at that was because of isolation. So we were identifying that after an isolation patient left, we needed to dump all of those items out and then restock it appropriately. We also identified that sometimes when clinical staff or other folks are going into the room, they come with extra supplies that aren't always found in those drawers. And then if they have them, since they've gone into the patient room, they kind of put them into that drawer. So then we're ending up with sort of extra items in the drawer, in the pass-throughs, which create some risk. In the past, when we would do audits, we would find lots and lots of expired supplies, and that's because we don't have a process to re-look at expired supplies or expiration dates when we're restocking that drawer, because we are pulling it from a fresh supply of item. So while this feels maybe a little bit weird to say, hey, take a look, if the items that are in the drawer are the things that are not on the par, we need to dispose those between patient encounters. we were already throwing away a ton of items and the expired part of the materials. So now we have a process to clear out the pass-throughs, to make sure the drawers are properly stocked, and it decreases our risk overall, both for infection and then also for using expired supplies. In the future, we hope to continue to address the cost part, because I genuinely appreciate you acknowledging that we are throwing away supplies that could be reused, but because of our Kanban process, that actually would interrupt our ability to check those expiration dates and get them restocked. On the flip side of that, I need your guys' help. If you feel like there are items that you are always bringing into the patient room because there's not in the drawer, and you feel like this is something that needs to be in there, escalate it to your leader, and we can have a team look at it to see if maybe we can change the par levels. The par levels in those drawers are intended to be the things that you need the most to care for those patients. And so if what you need isn't there, we can work on that. It won't be everything, but we're hoping that it's at least at 80% for you to do your jobs. That also means that culturally we're going to have to stop bringing in sort of extra supplies and the just-in-case items, because they will end up being disposed if they're not used.
All right, thank you, Ingrid.